that the shared governance structure provides a set structure of how decisions are made and consensus is reached about decisions that impact practice and the care that patients receive at Children's.
We want to hear your voice. We want to make sure that we are hearing from everybody in the institution at all levels. So again, having all that collective minds and ways of looking at everything is ensuring us that we're making the best decisions with patients and families for their kids' care.
Shared governance groups are actually making decisions on their own, with the manager acting as just the facilitator and making sure that they're staying within the infrastructure of the hospital.
Really tapping into your staff and listening to them and trying to understand where they are and what it is. And you know, sometimes it plays out as frustrations, but if you can spin it differently and get them to talking more about where you're trying to go and how to get there, they can take you there.
In order to solve the clinical issues, it has to be the clinician that helps solve that, or at least is a major part in that piece, because that's what shared governance is all about.
Listening to what the bedside issues are and helping the group problem solve themselves.
I think the different levels of understanding and ability to comprehend really what their role is. And I think as you're a staff nurse, it's not always easy to see beyond your patient or your unit, which you don't necessarily have to, but it does give people the opportunity to see the interconnectedness between units, between services, between departments, and all the ancillary things behind the scenes, the support services. And that it's not always as easy of a fix as some people would like it to be.
I think that an interprofessional shared governance structure is very important to interprofessional practice in the fact that every discipline within patient services is equally represented. You don't have one discipline that is receiving more quote-unquote votes than what another discipline does. Everybody has one person at the table, and so all voices are equally heard. And I think that it also keeps everybody on the same page. So you don't have people doing double the work. You can have different disciplines working together to achieve the same goals.
Well, first and foremost, ownership of my practice means that I practice according to the Ohio Board of Nursing rules and regulations. Shared governance makes me a better nurse. It gives me the broad picture. It allows me to have a voice in the workings of this organization and in those decisions that directly affect my practice.
Owning my professional practice means that those at the bedside or those that provide the care are the ones that actually make the decisions about the care that they provide.
My role as Senior Vice President of Patient Services in Shared Governance is one in which it's a hands-on and then one in which it's a step back. It's hands-on in that I'm there to provide the vision, the resources, and the support for shared governance to happen. But I take a step back in the decision making because really 80 to 90% of the decisions that are made at the point of care should be made by the clinicians that are closest to the bedside. Not that I can't make the decision, but is it the right decision to be made? In this way, by having those voices there, we're ensuring that we're making the best decision for the folks that are closest to the action.
Partnering motivates. So when you think about the frontline staff who are directly responsible for the work that they do and understand their practice better than I or any leader really, it's important to partner with them because then it becomes a us versus a I or them. Individually, we're more of a team. So that partnering alone motivates individuals to really move toward a common goal. And that has been really my whole reason for really enjoying the shared governance.
I think it's always important to have that connection with senior management and leadership, and being part of a neighborhood location and satellite facility and staff like we are, we always have that disconnect. So really getting to be part of understanding what they're searching for and wanting to create, and creating that connection and communication and trust, I think has been an important part for us.
Shared governance gives me the forum to be able to bring forth my ideas, my successes, my concerns around my nursing professional practice. We say all the time that 90% of our decision making should be at the bedside. So as a bedside clinician, that's very important to me. I want us to be able to advocate for our patients in order to get positive outcomes. And sometimes I need a broad structure to get that done, and shared governance affords me that.
I think the benefits are limitless for us, but the main benefit I see is the transparency that has increased with having shared governance. It gives us a voice. It allows us to have more team building. We have so many subcommittees that work together to work on protocols. It's just really strengthened our organization, I believe, as a whole.
And also see the level of maturity in the health unit coordinators in their professional role as a council is, you can't buy that. It's just rewarding to see them leading.
It's when you have a group of people that can take on a task and you see the enthusiasm in them solving the issue, the problem, and beginning to own it. And then if they can take that and spread it beyond their unit, and that's cool.
We had a project this year where we were working on a value initiative to decrease constant observations. So we had a retreat where we came together and worked on it, and then had specific goals that we wanted to target and go after that we developed committees for. And we used an interdisciplinary approach using nurses and doctors, MHSs, to research and work these together. And in the end, we wound up saving, so far this year, about $125,000.